We are now at the public comment portion of our hearing. And thank you for those who have lined up and are ready to provide public comment. For those that intend to provide public comment, please prepare yourself, and the line is self-explanatory there, and you can feel free to step up to the mic and make your comments. I want to encourage folks to keep their comments to less than a minute if possible, and so that everyone has a chance to make their statement and make their comments. Thank you.
Good afternoon. My name is Nancy Chance. I am a family member. My husband has a disability due to a traumatic brain injury that occurred about 9 years ago. I'm also the executive director of Choices Transitional Services, and I've been in this field, I just counted 34 years. So I've been in residential care, independent living services, day program services. I've done it, a lot of it. And I have a couple of things I'd like to ask, but before that, there were several people that asked, who's being affected as this system is in crisis? And I think the most important thing is the person receiving the services and those people doing the work. Those people are the ones that are the people that are receiving services are losing their services. They're not able to live anywhere on their own. They're there with very few services, so they're unable to do the things that they're out there to want to do. And the workers are terribly underpaid. You know, I see it with my husband and a system that he's caught up in, which is totally different than the system I work in, but they're the same. It results in delays, it results in denials, and then if you're not a fighter, you're not going to get your services, and that's unfortunate. So I just wanted to request that in this special session, you consider some targeted types of increases, looking at things like the minimum wage, increasing it for those places where it's going above the state mandated and funding that. But in addition, funding the exempt staff at double the minimum wage. That's a huge amount of money for most of us, is to bump that exempt staff up in addition. We weren't funded for the sick time if we were already providing some sick time, but people who weren't providing any sick time got a funding increase. I think that people that were providing it should be getting that as well. I think that we should be funded fully for the supported living, not supported living, I'm sorry, for the overtime. Overtime we were funded, and thank you for the 5.82, but I believe it's going to cost a greater amount of money. We need to research and really fund that. So those targeted kind of increases could go a long ways in helping our community while we work out this rate system. Thank you.
Thank you.
Hello, my name is Elizabeth Drake. I have cerebral palsy. I am here in support of the Lanterman Coalition and a 10% increase for the community. It saddens me that funding has still not been given to the community who work the hardest to support people with developmental disabilities. Without my direct support professionals, how can I live? Who is going to provide my G-tube feeding and changing? Someone like me would end up in an institution being abused and isolated, costing the state of California millions of dollars. Instead, in the community I work and pay taxes like everyone else. I will no longer be ignored. Why do I have to keep asking for something that was promised to me years ago through the Lanterman Act? My staff is barely making a minimum wage, so they quit and work at McDonald's, who pays more. My day programs and services are being cut or closed, and the list goes on. The time is now to act. I can no longer wait. This is a state of emergency. The community is on the brink of collapse. Thank you for your time and attention.
Thank you.
You okay now? Okay, thank you. Marty Emoto, California Disability Senior Community Action Network. I'm also a family member. I've been a direct care worker in the past since the mid-1970s, but prior to that, I've always been a family member of my older sister who had developmental disabilities. She died when she was 51 in the year 2003. For those of you who have asked, are we in a crisis? We've been in a crisis since that time, even before, because that was the year then Governor Schwarzenegger was proposing to suspend the Lanterman Act, and that's the year she died. We are in a crisis, and I think everyone in this building agrees that we are in a crisis. There's nothing today at this hearing or the hearings held in July or June or prior that is anything different that you've heard. The only difference is that we need action, and we need action now. There's two different sets of actions. We need a longer-term action, and we need action to deal with critical funding issues that are going to hit us in January that are hitting us now. The problem is this. There's no disagreement that we're in a crisis, but there's disagreements between Republicans and Democrats in this building about whether or not the wisdom of passing or renewing the managed care organization tax. But what is absolutely true, despite the differences of philosophy, is this. There'll be a $1 billion hole, and we can't even discuss, at least as advocates, or be heard about funding increases that we will need if there's a $1 billion hole. So we urge, regardless of your philosophy, that if you truly believe that we are in a crisis, that people need to come together in this building and at least agree on the managed care tax and then work on the other issues regarding spending that people have different opinions about. Number two, while that is happening, and I don't think it's going to happen actually between now and the end of session, I would ask that the legislature consider one-time targeted funding to help providers and the regional centers, one-time targeted funding to deal with the overtime issue, to deal with the exempt staff issue in terms of the minimum wage impact in January, to deal with minimum wage increases in the local jurisdictions, and targeted funding to help in those regional centers where caseload is a major crisis. We're talking about one-time targeted funding while the legislature and this administration work out the philosophical problems regarding the managed care organization tax or other funding sources. We cannot be left in front of the bus that will surely hit us in the coming months and weeks. Don't let that happen. Thank you.
Thank you.
Hi. My name is Ron Fell. I've been a volunteer in the system, never drawn a penny of compensation for my efforts since 1998. Started as an aide to staff at a day program in San Francisco. Currently, I'm chairman of the board of the Golden Gate Regional Center in my fourth year at that position, and I'm also in my fourth year with ARCA, the Association of Regional Center Agencies, where I now serve on the executive committee there. I wanted to impress upon you that all of our problems are going to be rooted in a problem that if you don't solve the caseload ratio issue with the federal government, you need to deal with the fact that we're out of compliance. That could have possibly affect us as much as $2 million if they decertify us for lack of compliance. $2 billion just for not meeting something we promised. The state of California promised the feds in return for their $2 billion that we would provide caseload ratios of 63 or 64, whatever their requirements were. And this could happen at any time. The feds are going to play hardball with us at some point. Within the Golden Gate Regional Center, we're losing 30% of our social workers every year because the core staffing formula says that we're supposed to start these people at $35,000 a year. You can't do that in San Francisco. You might be able to do it in Bakersfield, but you can't do it in San Francisco. You need to reform the core staffing formula, and you need to give us enough money to provide not only enough service providers, social workers, but to make sure that regional centers can retain those people and not have 30% turnover. So you have a chance, the 7 of you that are still left in the room here, of doing something noble doing literally something noble with your efforts and not waste your summer by going home on the 11th of September not accomplishing anything. Do something for the good of the people that are counting on you, the people that are supposed to be protected by the Lanterman Act. Thank you very much.
Thank you.
Good afternoon. My name is Linda Plord. I am the Executive Director of Bayberry in Napa and Clear Lake. Support 75 individuals with very intensive needs and employ 170 individuals. What I'd like to talk about today is not giving you a laundry list of why we're in a crisis. You've heard that. You already know that. We have been telling our story for the last decade plus, and certainly have been doing so quite vehemently for the last 7 months. What I do want to talk about is the difference between your world and mine. Something is wrong with our legislative system when it runs us into the ground every year and mandates nonetheless that we comply with the law. In my world, that is simply illogical. I have to believe my perception that in your world, it's simply politics. I have to be available 24/7, yet in your world, you get to go on recess while your constituents have no relief. Special session day 62. Using our most vulnerable as a political ploy. Politics, right? Gosh, in my world, that's simply unconscionable. I share my world with many people in this room, many people I would love to have here, the people that I support. They wouldn't be able to tolerate the ride to Sacramento from Napa. They would have probably minimal idea why they're even here. These are people with high needs. I would love for you to meet them. I would invite you out to Napa or Clear Lake to meet some of your constituents that we're begging for funding for. So again, I share my world with many people in this room, with the 75 people I support, and with my 170 employees, and with more than another 280,000 Californians with disabilities and their support staff. California has legislated complete support for people with intellectual and developmental disabilities, yet California makes us beg for the funding to implement it. Makes perfect sense to you, right? And I know that's a rhetorical question, but I have to ask it because we have to do it every year. We have to do it every year. So something about that must make sense to you. Let me tell you a story. Payroll for agencies like mine, for agencies like Carol's, who spoke very eloquently earlier, Carol McKinney, my colleague with CSLN. Payroll is a significant challenge. I've had times when I had to run to the bank to deposit my personal monies from my personal bank account into the Bayberry bank account to cover an employee's paycheck to avoid labor law complications. Does that make any sense? I don't know that any of you have ever had to do that. I don't own Bayberry, I'm its employee, yet I have to use my personal money at times to do that and to cover operating expenses. That has been my world. It's different from yours, right? I do want to thank you for your time today. I feel somewhat encouraged by the very hard questions from some of the Assembly members. I do appreciate that very much. I will continue to be the voice for those who have none. It is my job to comply with California's legal mandate to ensure their health and safety. It is your job to figure out how to fund the mandate. Is it possible for all of us to simply step into the same logical world where we fund a system that is legislated? Thank you for your time.
Thank you. I just want to encourage folks to try to keep their comments below 1 minute if you can, so it'll ensure everyone gets a chance to make their comment to the committee. Thank you.
Hi, my name is Rachel Nelson, and I work for On My Own, a vendor in Sacramento. Assembly member Susan Bonilla asked the question, how do we adequately explain what we are facing here? I feel that after many years of testifying, years of marching, years of rallying, thousands of letters, thousands of phone calls, many meetings with local legislative members, tweets, Facebook posts, and the people are still asking, why isn't the message getting across? I think the message is clear. We need the funding. This is serious and this is scary. The trigger started when rates were decreased and the rates were frozen a decade ago. I feel like fingers are being pointed at our industry like we haven't made our message clear and we haven't asked for the right things. We're asking, pleading, and begging for you all here today. We need the rate increases. This isn't a matter of discussion. This is a cry for help. We've talked enough. What are you going to do to prevent this from happening? What are you going to help today? Thank you.
Thank you.
Good afternoon. I'm Michelle Ramirez. I'm with On My Own Independent Living Services, serving approximately 380 clients per year in the Sacramento region and several counties. I want to start by saying that this is an emergency. It is. It didn't have to be, but it is. Our industry has endured $1 billion worth of cuts. It's an astronomical amount of money that we've endured. We had rate caps, rate freezes, unfunded mandates year after year. Meanwhile, our industry has endured an influx of clients to our industry, into our community. I simply haven't seen an industry in the history of California that has endured such an instability. We are all here today asking for something to be done because we truly are an emergency. You know, words have meaning, and forgive my nerdiness, but I often look up definitions. And so I looked up the definition of emergency. It's a serious, unexpected, and often dangerous situation requiring immediate action. Dangerous situation requiring immediate action. Sorry. So we're in an emergency. I don't know what that word means to you, but we're serious. This decision can't wait a year. It can't wait 2 years. We have hundreds of vendors that have closed their doors, and many more are going to follow the longer we wait. We have many clients being underserved or not served at all, and the impact is only going to get greater. We need the 10% increase. Thank you.
Thank you.
Hi, my name is Mark Melanson, Director of Community Services at an agency called Toolworks in the Greater Bay Area, also president of the California Supported Living Network. I wish I had some words of wisdom that would enact this legislation to take some action right now. I don't. You've heard it from everybody. You've heard the crises that we're in. And we need some immediate relief to shore up our system so that we can fix our future. So I would just like to say that, the crisis is right now. The urgent need for the legislature to take action and shore up our system is right now. And we need 10% right now. So thank you.
Thank you.
Mr. Chair, members, Guy Houston with Mission Hope Day program in the Bay Area. We serve over 400 behavior management clients in the Bay Area. Numerically, the case stands for itself. You have over 12 years of no increases in any type of funding. At the same time, the CPI index has gone up over a third in that same time period. So how can you run a business like this? So that's kind of the numerical part. But on the people side, you have clients and people that are in much great need are suffering with turnover. Mission Hope, in a couple of our programs, we have 5, our turnover of staff is over 90%. And when I first saw that stat, I couldn't believe it because it just intuitively doesn't make any sense. But what it is we have a lot of long-term workers who are very loyal to us, but then that lower 50%, they're turning over 2 and 3 times in the year. So we have this astronomical type of turnover. For our type of service we provide, that turnover that change is devastating for our clients. I've sat in your chair in the past, and I know what requires is Republicans to reach across the aisle, Democrats to reach across the aisle to get something done, because it is a crisis. I respect your time. I know that hearing things over and over again sometimes is difficult, but it is a crisis and it isn't going to end unless there's some action. Thank you for your time.
Thank you.
Hello, my name is Rashima Hollinsworth. I have 2 residential care facilities for developmentally disabled adults. I am a member and also a leader of 6 Beds Inc. And I serve the developmentally disabled, and we are literally at risk of closing. A lot of residential care facilities are at risk of closing, and that's on all levels, no matter what level it is. due to the inadequate funding that we have, Mr. Bradshaw had mentioned a lot of things that really hit home that I was relating to back there. Let's see. I got some information from the Department of Social Services, January 1, 2015, residential care facilities for adults. There is 187 that have closed, and also 309 residential care facilities for the elderly. 309 have already closed their doors, and this is frightening for me personally as a business owner. I don't want to close my doors to a population that I want to serve. I do appreciate your time, and I pray that there's something that you all could do to shed some light on this problem that's literally crippling our industry. Thank you.
Thank you. I'm going to let folks know when you're at 1 minute, and I encourage you to direct your comments to things that haven't been said before. And if you have any new comments or new thoughts, that'd be most helpful for us. Thank you.
Yes. Mr. Chairman, members, Bob Naylor, representing Six Beds, Inc. I'll just build off the previous testimony. Those numbers were from the Department of Social Services, and those were closures since January 1st. And one of the reasons for the closures, which hasn't been mentioned except to some extent by one of the panelists, is that application of California's overtime and double overtime laws to live-in caregivers, people who stay on premises 24 hours a day to give care and get free room and board. That application has increased labor costs for these homes by 60 to 120%. The rates don't recognize the full application of the labor laws. So one thing that you can do that wouldn't cost money would to provide relief on a very targeted, limited basis from the overtime laws in California for live-in caregivers. These are people who are otherwise going to lose their jobs and lose their residences if the homes are put out of business, and that's one of the reasons, one of the big reasons for the closures. Thank you.
Thank you.
Good afternoon, Matt Robinson with the California Association of Health Facilities. Now, we have 1,100 intermediate care facilities for developmentally disabled throughout California, and these serve about 7,000 individuals throughout the state. Now, these groups of homes, they're 6-bed homes. However, they're 100% Medi-Cal funded, and they still provide a community-based service within the home, and they also have a day program that the individuals go to outside of the home. Now, they are 100% Medi-Cal funded, but they've also are on a 2008-2009 rate freeze, and they also sustain the AB 97 cuts. At the same time, the ICFDDs, they also pay a provider tax that goes back into the general fund. Now, these guys as well, they are in crisis. There have been over 66 closures since 2012, and we're just asking that the ICFDDs don't also get lost in the shuffle. Thank you.
Thank you.
Chair and members, Kathy Mossberg with the Developmental Services Network. In the interest of time, I'll associate myself with my colleague, the comments by my colleague Matt Robinson. But it is true, we were one of the first providers to step up and pay a provider tax. That tax, coupled with a federal agreement on transportation and day programs, pulls in $70 million into the general fund while we're still seeing a rate freeze. We are in crisis. We have seen closure. We urge this committee to address this issue when they do address overall DD issues. Thank you.
Thank you.
Good afternoon. My name is Stacey Sasson. I work for a local supported living agency here in Sacramento. We are one of those agencies who has given notice and said that we are not taking referrals any longer, and that's pretty sad after we've been in business for 21 years trying to close down the developmental centers and bring people into the community into a life of inclusion. I would like to say I thank many of the members today for their comments, particularly Mr. Thurman, who reiterated the urgency of funding our system now. And also, I appreciate Mr. May's comments and questions about the duration of this crisis. I'd like to say, we got time. It's okay. We've only been in crisis for a couple days, but that's not the case. It's been years. I've been in this business for over a decade. For as long as I've been in this field, we've been in crisis. It's scary. And I know you guys were just on summer recess. We weren't. While you guys were on summer recess, we were, what are we, 62 days in now? So every day that passes, we dig ourselves deeper and deeper and deeper into this hole of budgetary neglect. And the deeper we get in there, the harder it's going to be to climb out. And right now, I can't see daylight. I'm pretty scared. We're all pretty scared. That's why we're here. So
you're at 1 minute. Please wrap up.
I hope that you enjoyed your summer recess. I hope you came back rested, refreshed, ready to work, ready to find a solution, because we are in crisis. It's not a drill. You're not being punked. There's not a hidden camera anywhere.
Thank you.
Hi, my name is Christine Bagley, and I'm from Strategies to Empower People. I just want to echo Sue North's comment about the bipartisan effort. I think that there's a lot of really smart people that can think outside of the box on this issue. I also wanted to invite you to be, not just have the conversation, but to be part of the conversation and invite you to the rally we're having on September 4th. So I encourage you to come and see what our community is about, and so there's some flyers. Thank you for your time.
Thank you very much.
Hello. Hello, my name's Tim Hoban. I'm a father of a 31-year-old daughter with disabilities, and I'm here partly just to speak for family members who number in the tens of thousands here in California. You probably won't be hearing too much from them because most of them are just treading water and just trying to stay alive with their families, take care of their children. So I just want to let you know from that side, I'm up at night sometimes and during the day wondering who's going to help solve this problem. The people on this subcommittee, my hope is that this subcommittee group and those supporters within the Senate and the Assembly are going to lean on our governor to in sufficient amounts to change his mind and change the non-believers or the people who've chosen politically not to follow this. Also, this 10% raise...
You're at 1 minute. Please wrap up.
Come on. I'm not asking for a handout here. We're asking for the state to follow the laws that it wrote itself. So please consider that 10%. Thank you.
Thank you, sir.
Hi, my name is Amy Alexander, and I'm from Livermore, California. I just want to know if you guys can keep our jobs.
Thank you.
My name is Amy August. I'm from Livermore, California. You trust me? Remember me.
Thank you.
My name is Maria Diava. I am a correspondent at Livermore. And please keep the community on the program. What do you call? And job. Please keep the program continue. Please, thank you.
Thank you.